Test, test, test.
Okay, folks, we're going to get started. Welcome to the January 12th, 2026 meeting of the Opioid Settlement Advisory Committee. Genuinely my nightmare. um, okay, so before we get things moving, we do have a couple of announcements, housekeeping type items. One is that we have a card here for Kay, our esteemed colleague. So if you have time this evening, or we can pass it around for folks to sign, write her message, send her our well wishes. Um, we also, Shalisa and I were talking about possibly like having a section that in the notes that kind of like we have in front of us for like a parking lot. So basically, like as questions and comments that we all, I'm sure, have arise, or ideas that maybe aren't directly related to the agenda item in front of us, like we'd love to be able to flag that to come back to and make a plan at the end of every meeting when we're going through action items um, to address whatever's coming up for us. So just keeping that in mind. And then um, we also got a little clarification in the last few weeks on our role as a committee. Um, with respect to the RFP process, which is to say we will be working independent of the RFP process. Um,
Hey, Kristen, are you able to hear me?
Yeah.
So where we're getting the strategies from, you remember before we had the public meeting? And so from the public meeting, they gave us information on what they want to see within the community, how they want this money to be spent whenever it comes to, get the funds out to the community. So those are the strategies that is in the RFP. So
Strategies are from the MOA.
Yes.
well, yeah, I mean, the strategies are from the MOA. However, we had to also include, the strategy, what our client or what the community stated that they want to see. So you wouldn't, I'm not gonna say you couldn't, but in theory, you wouldn't want to choose a strategy that's not what the community wants.
Do we have any, sorry, just trying to talk about it. Do we have any summary or documentation that came from that?
It is one, and you all didn't receive that. Let me see, I'm Jason, we can send that out to you because there was a summary of that last meeting.
Someone
Yeah, so it's your.
Okay, yeah, I have it, yeah.
Okay, so we can send that out, that will make it a little bit clearer, because through that town hall, that is what. We had a survey, there was a town hall, and through the survey, that's how. Okay, so you need that information.
You did. And it sounds like for this committee, we need to choose who would represent this committee or not. Oh.
You could also try this one.
Oh, okay.
So
Well,
it could be one could be another.
oh yeah, you want that one? And we'll use this one. Great. Okay, so for our items for later, I have that we need to choose representatives from our committee for the RFP process. And that we also need to follow up about the asks that came out of that community meeting. Okay.
And then when are we deciding what the strategies that we're going to recommend that today?
We have planned to do like a mission and vision development today. Jason asked that we also come up with goals, but I believe that the next meeting, the February meeting, is when he asked that we have the recommendations for strategies ready for him. And I think we have several options maybe we can talk about as we're talking about mission and vision for like what that very quick and dirty process can look like for us. Because like most of you, I mean, like all of us, I think, we want to make sure that this money is going to benefit people who are most affected by opioid use and overdose.
Hello, guys. Can y'all hear me?
Process can yes. Look like for us.
You guys can hear me?
Yes. Most of you, I mean, like all of us, I think,
Sorry. Is the mic working? I'm sorry. Good evening, everyone. Good evening. I'm sorry to interrupt. Just wanted to help us to move on to the agenda. I don't know where you are. I'm sorry. I know there was a lot of technical difficulties. I know we had people watching as well that's broadcasted as well. So sorry for technical difficulties. It's our first in-person meeting. Sorry I couldn't be there with you guys as well. And so let's go ahead and follow the agenda. We'll try to do our best to share the agenda as well so people can kind of follow along with our structured process that we have. And if there's any other additional questions, I'm sure we can feel free to do that. Thank you guys so much. Wish I could be there with you guys. And back over to you guys, Brittany.
Great. Okay, thank you. So the next item on our agenda is to review the bylaws, update, and vote on those. And I believe we're going to pull those up on the screen and just review them quickly. Oh, we also need to approve minutes from last time. Yes, Paul. We have 7, so we do. Yeah, it's a great question. The minutes? Okay, so these are the minutes from our last meeting. We want to briefly look them over quietly to ourselves. And then once we reach the end, if we could have a motion to approve. Make a motion to approve. Second. All in favor of approving? Right, great. The motion passes. And so now we'll look over bylaws.
One just very minor comment, which is the layout needs to be adjusted so that the words don't go through the logo of the back pages.
Great. I want to make sure that the folks online heard that Karen suggested that we adjust the formatting so that the text is not going through the county logo, the letterhead.
Also wonder, this is Shalisa, if there's somewhere in here, maybe this comes out with, when we do our mission and vision statement, but there's a lot of focus on the language of high impact strategies. And there's not really, I didn't see that like anything under the mission and purpose. But again, that might be better for us when we do our vision and mission statement, instead of messing with the bylaws, or playing with the bylaws.
All right. Does anyone have other comments, suggestions? Yes, Paul.
I don't, Jason asked us, and that's correctly again, do we have any before?
We did not receive any. Yeah. All right. So I guess we should vote on the text change and then vote on the bylaws pending the change. Okay. So motion to request a reformatting so that the text doesn't run across the county letterhead. Second. All in favor? Okay, motion to approve these bylaws pending that change. Second. All in favor? Great. Thanks, folks. Now we will move on to mission and vision development.
Thank you. Thank you, Brittany. So we need to develop a new or a mission and vision statement for our committee here. And so we thought just to get us started, we could just start with a simple prompt of the Durham County Opioid Settlement Advisory Committee envisions. I don't know if we would like to maybe take like 5 minutes where everyone writes down a suggested vision statement and then we come back together and share. Or if we would like to just do this all as one group, since there's just 7 of us here today. How would y'all like to work through this process? Mm-hmm. Mm-hmm. Okay. Sure. So in the bylaws, the mission of the committee is to contribute to the effective allocation of opioid settlement funds in Durham County by sharing perspectives and fostering collaboration to support programs and services that address opioid use disorder, co-occurring substance use disorder, and mental health conditions. Y'all want to start there? Is that a statement that you would like to use, or are there any revisions to it or additions to it? Sure. So the mission of the committee is to contribute to the effective allocation of opioid settlement funds in Durham County by sharing perspectives and fostering collaboration to support programs and services that address opioid use disorder, co-occurring substance use disorders, and mental health conditions.
Question about that statement.
Sure.
Does the co-occurring also apply to the mental health condition? Because I think, I don't think this money, I could be wrong, can be spent on general mental health conditions, right? It would have to be.
Yeah.
So I just think maybe we need to be clear that the co-occurring, that the mental health conditions are co-occurring to an opioid use disorder.
So maybe having co-occurring substance use disorders. Could you repeat what that last suggestion you had? Co-occurring mental health conditions? Okay. Opioid use and co-occurring mental health conditions.
I think Paul was suggesting just co-occurring disorders, which would.
Disorders, okay.
include both mental health.
Uh-huh. Yep. Okay.
I'd like to, can we read the original language one more time? Sorry, I'm not.
That's okay.
Is there a way we can put this up
Yeah.
on the screen?
Yeah. It's our bylaws, the ones that were just approved. There's a Article 2, the mission and purpose. So this is the current vision, current mission.
Not to make it even more complicated.
Huh?
But this is very specifically about people with opioid use disorder,
Yeah.
and people who don't have a diagnosed opioid use disorder are also affected by opioid overdose and other
Mm-hmm.
factors. I don't know whether it is, this might be getting too much into the weeds, but if we're thinking about the broad picture, then I prefer language that is more expansive than disorder, because it
Yeah.
means all people who use opioids are affected by opioid disorder, not just people who have a substance use disorder.
Yep.
Yes.
Yeah.
What about? So I would like if we could say something along the lines of like, we want to support programs and services that benefit Durham County residents who use or have been affected by opioids,
Yeah.
right?
Yeah, and also, go ahead. Yep. Who use or have been affected by opioids.
Or maybe who use opioids or have been affected by opioid use.
Opioid use.
I think to Lofton's point, not everyone who uses opioids has opioid use disorder. So they're not necessarily affected by OUD.
But everyone who has OUD uses opioid.
Yeah.
Yeah.
So we could have both, if it's important, it could be,
Yeah.
we really want to make sure that we have the OUD language specifically as well. So we could say residents of Durham community use opioids, including those with opioid use disorder, or something like that. If we want to have both.
And the other thing I would say when it comes to language with mission and vision statement, like it should be language that is, it's really accessible for folks who are outside the group. And I think going back and forth with the language around disorders, conditions, it might make it very difficult for us to like translate this to someone who may be new and hear about this committee, hear about what we're doing here.
Did you have a comment or question?
No, I like where we're going with this. I just went down a rabbit hole of like, there are people who are affected by, who overdose, who didn't even know they were gonna use opioids.
Mm-hmm.
So they're not even opioid users, knowingly opioid users, so.
Mhm.
Yeah,
We could
I'm all for making the language broad.
Yeah.
Mhm.
Yeah.
Okay.
Okay. So, yeah, go ahead. Sorry, go ahead.
We could also add overdose to that if we want, like, by opioid use and overdose.
Yeah.
So it sounds like the current version we have is the mission of the committee is to contribute to the effective allocation of opioid settlement funds that benefit Durham County residents who use and or have been affected by opioid use or overdose.
Yeah. Maybe use opioids.
Use
Yeah,
opioids?
use opioids or have that, yeah.
Okay.
And then we want to keep the co-occurring. Or we feel like that's implying.
I think we took care of it.
Yeah.
Yeah.
I think it's in there, yeah.
Yeah.
My question would only be, I don't know the language of the settlement enough to know if, I guess that we would leave that to the staff to guide us after this draft, to make sure that we're not
Mhm.
saying anything that's outside of what the
Mhm.
settlement's allowed to be used for.
Yep.
I think I'm pretty confident we're,
Okay.
but yes, I'm sure.
Yeah.
Folks are done.
Yeah. The NC Core Group, they use high impact strategies as the way to describe the allowable programs and strategies that we can actually fund. So I don't know if we want to put high impact in there somewhere. High impact programs and services.
I hear high impact. I'm just wondering.
Mhm.
Reality. Like, part of the, part of the,
Or just evidence-based?
I'm thinking we're always gonna fall short of that.
Yeah.
Yeah.
I think maybe evidence-based, because targeted, I don't think we want to use that language. Right.
Evidence
Evidence.
based that along the line of plan.
Mm-hmm.
Yeah.
Okay. So evidence-based programs and strategies.
Oh, and evidence based is also along the same line of ways.
Mm-hmm.
Got
Okay. So one more time. That's all right. I'm trying to keep it together. So the mission of the committee is to contribute to the effective allocation of opioid settlement funds that benefit Durham County residents who use opioids or have been affected by overdose. Right? Is that correct?
Opioid use or overdose.
Opioid use or overdose, to support evidence-based programs and strategies. Well, we have to figure out how to put that in there.
I'd say to support evidence-based programs and strategies that benefit.
Durham County residents, okay.
Can I, sorry,
Yeah.
another mention, Durham County residents.
Yeah.
I'm a little nervous, 'cause I
Mhm.
don't, I would hate for a program to not be able to serve someone who's in front of them because they don't meet.
Yeah.
Yeah.
Maybe just.
So I do like this in
People in
Durham
Durham
County.
Yeah.
Cause it's.
Yeah.
Not where the program is and.
Okay. Yeah.
Yep,
Great. Great.
that benefit people in Durham County. Okay.
I think did we use the phrase by sharing perspectives and thoughts to find ways, is that important to the business?
Let's say the effective collaborative allocation.
Let me see, I'm gonna type this in.
Oh, it's gonna be a long.
It is, and that's the other thing, the mission is supposed to be something like, you know, you kind of,
Yeah.
We can.
We ain't
chunk
even
it up,
got to
though.
the
We
vision.
Have everything.
That's true,
Uh-huh.
yeah.
okay.
I guess I do feel like there should be something that says how we are contributing. And I feel like the sharing perspectives of fostering collaboration is describing what our contribution is.
Okay, yes.
I'm trying to get us together, at least I'm trying to get the sentence together, type it up just to make sure I'm gonna read it to y'all in a little bit, just gonna make sure. Mission.
Did you have something, Paul?
Yeah, that's just, any questions? So I'm just wondering. You know, spirit of where we begin and what their expectation should be of us. We consultants, or we leaders, or we, and I know about managers, but now, what are we in relationship to this issue? Should that be part of? So,
I guess we're advisors, right?
yeah, I guess technically it's advisory committee, yeah, so every word we tell. Yeah, just like, I just wondering, just to clarify again, kind of like, because, not have false expectations. Be true to our, where are we? Post, kind of stuff. World.
Yeah. So I'm gonna read this one more time in lockdown. I'm not sure if I got what you contribute, but so far have, again, the mission of the committee is to contribute to the effective allocation of opioid settlement funds to support evidence-based strategies that benefit people in Durham County who use opioids or have been affected by overdose.
Opioid use or overdose. Or who use opioids or have been affected by opioid use or overdose.
Or have been affected by overdose.
Sorry.
Okay. Or, and then Lofton, what was your contribution around the collaboration, sharing perspectives?
Just not, I don't know where to put it, but just thinking
Okay.
that we should probably keep that somewhere because it describes,
Uh-huh.
to Paul's point, like what our role is in contributing to the effective outcome.
Mm-hmm.
Like to make it clear, we're not providing the money or making the decisions, we're providing the perspectives and fostering collaboration.
I mean, it could be part of our vision statement, right? Because the vision is what we hope to see. And hopefully, even past the point of the purpose of this committee, fostering collaboration is going to be part of what we're doing together.
Yeah.
So what do y'all think about the vision statement?
Yeah, I think that's fine. I think it also, if we're gonna keep it, we're gonna keep in the support discussions. Or we.
No, I think, yeah, I think that we were trying to make the mission like a one sentence.
Mm-hmm.
Yeah.
Yeah.
If we take that, because I was just thinking in line with that, say something, our advisor role or capacity, we would be doing these things. Talk about, again, so that people don't see that somehow we're spearheading and we're driving strategic discussions in further.
Yeah. I think.
I mean, the other thing is too, if we can't include everything in a mission and vision statement, we do have the bylaws.
That's true, yeah.
So sometimes you just can't have everything in the vision and mission statement.
You could change contribute to advise, so the mission is to advise on.
Mm-hmm.
All of that.
Yes, that is.
Great.
Okay, is to
Yeah.
advise.
Yeah.
Okay, okay. So we have advise is to advise to the effective allocation or something, maybe we can figure out another way to put that, of opioid settlement funds. Okay. But what about our vision? And the vision, is supposed to be like what we hope to accomplish.
And it's like it is like the vision, right? It's not even like, here's what we hope. It's like our vision is the good thing without like a hoping language.
Like when the work is done,
Yeah,
yep.
when the work is done, what will we be? Patting ourselves on the back for.
Making Durham
Mm-hmm.
more healthy. Is the vision also just like a sentence or what is it?
Mm-hmm.
A sentence.
Yeah. So we have the vision is that Durham is a more healthy community.
How to reduce stigma and barriers.
Yeah. Yeah.
with reduced stigma and barriers. To,
Where evidence-based programs and services are invested in or supported or
thrive,
thrive.
or the people thrive.
thrive, the services and programs thrive,
Evidence.
evidence-based programs and services.
I think,
Sorry.
oh, go ahead, please.
Well, just I like where you're going with the people thriving, because our goal should be an
Yeah.
organization thrive.
Yeah, is there people,
Wouldn't it be great if we didn't need our organizations?
Uh-huh.
Because, yeah, so something about.
where
we
all
need to
people,
focus on people
Uh-huh,
thriving,
yeah, and I think,
but not, I don't want to exclude evidence-based practices, right? I'm not gonna cut that out, but.
I think for me, it's like, there's also like anyone affected by opioid use has easy
Access?
easy access. I was gonna say like also abundant, but that's not the word that I mean, but like easy, like barrier-free access
Barrier-free
to
access.
the services and programs that they want.
And maybe that's what the evidence base.
Yeah,
Mhm.
Yeah,
Services.
yes,
yeah,
yeah,
yeah, easy access to, yeah, because reality is people use drugs, people aren't gonna stop using drugs, but what we're trying to create the society where
Mhm.
the options for health and well
Yeah.
are available and abundant. Yeah.
That's right, that's right.
You're thinking. Then our scope, we don't really only have one focus. One tool, we have, we want to put it, which is the second funds. And whatever we do has to be almost really that for.
mhm,
Yeah.
Said something to do with that, ensuring use of funds are applied to initially that. Be to that ensure everybody's practice to.
Right, or that have fidelity to the MOA, because that's all laid out.
Yeah.
Mhm.
Right, that we're ensuring some integrity to the process, so, and stuff. Right,
mhm,
it's really our scope, again, we're
Yeah.
narrow lane here.
mhm, yeah,
So the vision is that Durham is a more healthy community with reduced stigma and barriers where all people have barrier-free access to evidence-based services and programs.
It zoomed out the lines, that feels right.
yeah,
Okay.
But then I do agree that since we are the settlement committee, I feel like we should have that more specifically. That our role is to guide the implementation of the settlement money in a way that holds true to the vision of the settlement.
Mhm.
I would like to have something in the vision about what the settlement is about, which is about the loss of life.
Yeah.
People who died.
Mhm.
mhm.
So I want to add in like in Durham, okay, so I'll read it one more time. The vision of the Durham OSAC is that Durham is a more healthy community with reduced stigma and barriers where all people have barrier-free access to evidence-based services and programs, and Durham settlement funds are used.
Are used.
For optimal effect, for optimal benefit, for optimal outcome, that we're all. That's what.
Yeah. In a manner consistent with the goals of the MOA or whatever the actual that word is.
Are used consistently.
And with, this is not the right language to use because, but with, consideration of with reverence for
Mhm.
origin of the money, which is in loss.
Life or loss of life, yeah.
Yeah. It's hard to come up with like a phrase you want to write down that kind of just means blood money,
Yeah.
Yeah,
you know?
so what we have so far as a vision is that Durham is a more healthy community with reduced stigma and barriers where all people have, well, no, Durham is a community, healthy community with reduced stigma and where all people have barrier-free access to evidence-based services and programs. And Durham's settlement funds are used consistently in the manner of the MOU with reverence for people who've lost their lives.
Which I think we should take out. I mean,
Mhm.
say the first part again.
It's just the vision.
Stigma is fair.
Okay.
I feel like we're sort of, maybe if we're saying barrier free, then I feel like taking.
Yeah.
That kind of encompasses stigma, I think.
Okay.
It just highlighted stigma alone as one of the barriers.
Mm-hmm.
Yeah.
Yep.
I also wonder about services and programs, like, is that redundant?
Mm-hmm.
Just to
Maybe.
try and make less words.
Yep.
Yeah.
Evidence-based services or evidence-based programs.
Services to me feels more all-inclusive.
Broader. Okay. 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 So services. Okay.
Yeah.
So we have the vision is that Durham is a more healthy community where all people have barrier-free access to evidence-based services, and Durham's settlement funds are used consistently in the manner of the MOU with reverence for people who've lost their lives.
I wonder if, okay, this is one more, maybe wrench. What if we change services to like resources, evidence-based resources? Because that can be like a program, a service, an item.
Love it.
Mm-hmm.
Right.
Love it.
Yeah. Okay. Resources.
Evidence-based research.
Do we want to read it one more time?
Yeah. And then next time we will be tested on it.
Okay, yes, yeah, yes, because we're all gonna have to memorize both the mission and the vision
It's
statement.
our scout pledge.
That's right. So the vision is that Durham is a more healthy community where all people have barrier-free access to evidence-based resources. And Durham's settlement funds are used consistently in the manner of the MOU with reverence for people who've lost their lives.
It's MOA, should be MOA.
MIA, okay, all right.
We need to say what the evidence-based resources are for, or is that clear? Is that implied from our mission? Or if we can be more specific about what, like, cause I feel like we're really broad when we're saying we want to be a healthier community and then evidence-based resources.
Yeah.
We don't actually say like evidence-based resources to reduce overdose or to improve health quality of life.
Mhm.
Use opioids or
Yeah.
Yeah,
use drugs
Yeah.
or whatever.
I mean, it could be somewhere else, like in our collaborative strategic planning process,
Yeah.
where we actually list like the priorities for the evidence-based resources that we want to advocate for.
Yeah, that's fine.
The evidence-based is a real
Well,
robust, so that it's not big, and it's more like it operates on a continuum, there's best practices versus worst practices. We have a pretty good idea about those, evidence-based practices, yeah, I do. Some things, but there's still some things that there's not very much time study. It's still a process.
Talking about practice-based evidence.
Practice-based evidence, I think, yeah.
But I guess probably we're spending our money, or we're advising on spending money on things that are.
right.
That are
yeah.
evidence-based, yeah. Okay.
Can you read it again? There is a, sorry, did we address your?
I think so, yeah. Yep. Go for it.
There, can you read it again? I'm sorry.
Sure.
The thing that didn't quite get.
So our vision is that Durham is a more healthy community where all people have barrier-free access to evidence-based resources. Durham's settlement funds are used consistently in the manner of the MOA with reverence for people who've lost their lives.
I think it's consistent in the manner of, I think you could just say consistent with.
Yeah.
The MOA.
Consistent with,
Is this
yeah,
some
so
of the
the,
guidance from the MOA maybe, or?
yeah, consistent with the MO, okay. Yeah, it could definitely cut down some of the words, okay.
Traffic noise,
All right.
memorize it. I think that's.
Okay. So how do y'all feel? Y'all feel we have a good mission and vision to start with? And maybe we could think it over between now and our next
Yeah.
I guess
Meeting.
once we all see it rather than.
Mhm.
Yes,
Mhm.
okay,
And we can send feedback in the meantime, right, as long as it's individual, like not reply all.
Correct.
Yeah.
Yeah.
That would be good.
so I'll send both draft statements to Jason. And then ask him to send it out to the entire committee, and then when we come back in February, we can finalize it or approve it.
Great.
Okay.
Well. Great work, folks. Um. That brings us to our action items and next steps and parking lot. So, and agenda items for the next meeting. So we have in our parking lot, I had added a while back so that I could keep this in mind, that eventually I'd love for us all to like, agree on like some shared language for like for moving forward in our strategic planning process. I think that's probably at the earliest we could get to that would be like the March meeting. But that, for example, like, do we say opioid use disorder? Do we say people who use opioids? Do we say people affected by opioid? That kind of thing, like just to get some consistency. We need to get more info, it sounds like from Jason, on who represents this committee in the RFP process. We need to follow up regarding the outcome from the spring meeting, community meeting. That's the one that where community members offered input on what strategies to prioritize. And then independently review the mission and vision statements and kind of marinate on that. For the next meeting, we will need to make a recommendation about what strategies to prioritize. What do we need collectively besides that community input in order to feel equipped, I guess, to make that decision? Yes,
I
Paul.
guess maybe clarity of. Yes.
Mm-hmm.
Mm-hmm.
How, what do you, is there anything you
I
can
was
think
gonna
of?
ask, not sure how to, sort that maybe, like, Jason or someone else have that information, has that been identified? Process that suit us, you know, we'll some gap analysis.
Mm.
Is that already been done?
I'm wondering if Kristen knows.
So, we actually, that information from JP, because from that dashboard, that information should be up there, but also you can, you can pull that information from you.
Great,
Mm-hmm.
cool.
So it's
Thank you.
basically like we already looked at page 3 of the RFP where they have the strategy, the list of 12 strategies. We're just gonna be like, we like number 4, 7, 8.
Yeah.
That just feels so kind of
Yeah.
meaningless a little bit and difficult to do without knowing what the proposals
What the-
actually are. Like, I guess I just wonder if there is the opportunity for us, maybe we still have our 2 representatives who are doing the actual review of every single, you know, proposal that's submitted, and maybe some of those would be weeded out by the process of doing the rubric, but is there a way that we can have more, like, a sense of, okay, these are sort of some of the top proposals that are being thrown out, like, is there a way that we can be involved in at least reviewing the big picture of what those are before we make those recommendations?
This is a great question.
Yeah.
I guess the other question I have.
Yeah, I was gonna say, I know we had asked before about seeing what they had already done.
Mm.
Because from my perspective, if they've already done some things that might not be as much of a priority from this group, it'd be certainly what you recommend, and they continue to throw more of the funds at those items, like chewing bubble gum and walking at the same time, shift to something a little more important for the community.
So I think those are the presentations that we got, right? So we heard from the harm reduction, the county harm reduction program. We heard from the,
Community paramedics.
and
Yeah.
then yes, thank you. I was like, the pulling people together yes, the peer support, like the navigation.
And the data piece is also something that's gonna be funded already, right? Just like the data dashboard and whoever's working on that, I think.
I think so, but that's a great question.
Yeah.
We can ask.
And like where, with the current funding or the groups that have been funded so far, this is on the dashboard on on our committee page. There's a dashboard that shows, and also an NC Core's page that shows what Durham has been funding so far.
Yes.
So I'm not clear on, like, those things that, those groups that reported to us. Is there some time, are they having to submit RFPs or are they locked in for funding? They're having to.
Everyone has this.
Okay, so we have to be careful about gaps, because if we're
Yeah.
already funding something that's filling the gap, and then we say, well, that's not a gap, because. it's
Right.
filling it, but then we don't fund, like, I'm with you.
Yeah.
I feel like there's some parallel processing that doesn't feel like it's happening.
Right.
Because if we say, oh, we gotta do this, whatever, reentry program, but then we mistakenly don't prioritize
Right. What's our,
syringe exchange, which we're already, I don't know, I'm just worried that I don't quite understand the whole landscape yet.
yes, this is, yes, a great point.
So the programs that we heard, that we already heard about in our previous meetings, they have received funding in the past. They're gonna apply again. Could
Yes.
fund them again, or we could advise on the strategy that they fall under as a priority, but they're not necessarily gonna get funded.
Correct.
Again, just depending on,
Correct.
everything's going through review. Okay.
Yeah.
So nobody's got a recurring
Agreement.
agreement? Okay.
Oh.
And we,
Sorry.
And also, you can, what you can do is, even though someone is being funded, you can determine, or you can say, well, yeah, we want to fund this program, but at what amount? So maybe you fund multiple programs, but limit the amount.
Well, I guess Jason mentioned that the county commissioners will determine the level of funding.
You put in your
The
recommendation.
recommendation.
Okay.
And a
It's your
more.
recommendation.
And that could be to accommodate another provider to do something else that's not.
That's about currently being funded. Yeah.
It would be a recommendation. And of course, none of us would ever have a crystal ball in this process, and I'm always wondering, what happens if everybody submits, whoever's interested in doing anything to respond, if it's all syringe programs.
Right.
It's like, what do we do then? It's like, we only get, do we put it back out for bid, or what do we do in a situation like that? We may not know the answer, I'm just wondering.
Yeah.
Generally.
Should we be prepared for that possibility that somehow, we're limited in how we can be true to our vision, our mission, if the community doesn't provide.
Proposals, yeah.
So I don't know how we shape that, or if we shape that. But we just don't control it.
Yeah, I don't think we have any clear that.
All right. Do we have anything else? Do we have anything else that we need before the next meeting or that folks would like to see on the next meeting's agenda?
So next meeting is when we'll say, like, these are the priorities, and we need to decide that.
And decide who from this committee will represent
Yes.
part of the RFP.
Which
I
will
guess I think
definitely
we
ask
need
for.
more clarity on like what we're saying when we're saying the strategies that we're prioritizing, because it sounds like, from what you said, like maybe we have some input on like, we think multiple resources, but like, I feel like we would need quite a bit of input on like, that there are multiple proposals in this category and that we think all of them are valid and like, you know, high impact or whatever. So how are we gonna get that information in time to, or are we gonna get that information?
Yeah, there's also, I guess, you know, what are the other resources available to potential vendors? That, you know, in other words, if you have someone who's, just saying, people, you know, who want the money to do treatment, but they have access to other resources that don't necessarily require settlement funds, like insurance. I mean, I'm just saying, how much do we factor in? Well, we want to hit all the things on that list, but maybe there are other ways that those needs can be addressed that don't require settlement funds.
I can't speak to this process, and I know that we're not part of designing the rubric or the RFP, but in other funding processes that I've been part of, we ask to see both like a program-wide budget, or occasionally that means an org-wide budget, as well as like a project budget. And we ask to see evidence that they're leveraging other funds. That's been consistent across, I think, every grant I've ever worked with. I'm not sure if that's part of this process, but it would be, that is one way I think that we could see, okay, like what other funding streams are coming in
There are funds
for
that
folks.
people have access to then sustainable
Right.
resources. That could be a strategy, is funding things that.
That'll be sustainable.
Right, exactly.
Agreed.
I mean, the good news is there's no bad strategies in the list.
Right.
That's
So
true.
we're not-
Yeah, so,
Something that-
Yes.
We all agree on that.
Yes.
right.
Yeah.
All right.
Do we want to have a hybrid meeting similar to this one for our next one, or do we want to meet online?
The hybrid seems like it put people through hell.
Yeah. Seems very difficult.
Hybrid meetings are really
Yeah.
difficult sometimes. The mic.
Yeah, I mean, we might get feedback that just whoever was listening, like,
Couldn't hear us.
Couldn't tell what we were
Okay.
talking about, or it may make more sense. to
Yeah.
speak all on Zoom.
Okay.
And also, me personally, if they continue to be at 5 p.m. Mondays and Wednesdays, that's like at the end of my outreach shift, so it's
Right.
a lot easier for me to call in
Call in.
Okay,
rather than have to leave.
yep,
Sounds good.
okay. Hybrid in February, back on Zoom in February.
Back to Zoom, baby.
All right.
This might be a
Yes.
parking lot thing, but I'm still not clear on how much money there is, how much we're spending.
Great.
How much, is there more that we could spend if we identified another priority? I'm just not totally clear on the finances of this money.
My,
What they want our input on that, like,
right.
to what extent are we even involved in that part of it? Is it, we don't say anything about finances, or we just say we like these ideas, or we like these programs, or are we getting more specific, please, you know, we think we should fund multiple programs with smaller amounts of money to fit the budget. Like, I feel like there's a lot of way we could interpret what we should do.
Do you want to share from Shalisa, from the call?
Yeah, so during the RFP webinar last week, there was a question about like, what is the actual funding amount total for this year? And it's 1.5 million. But there is a little bit of flexibility, I think, to maybe go a little bit above and a little bit beyond, but that's pretty much the ballpark. Mm-hmm. Yeah.
All right.
Motion to adjourn?
Second?
All in favor?
Aye.
Thanks, everyone.
Thank you, y'all.
Extremely excellent chairpersonship.
Yes.
Thank you.
you.
Excellent committee membership.
Exactly, absolutely.
And audience. Many things.
And I think that they got y'all, that they got us. Food.
Oh, they did.
Oh, yes,
yeah.
I got it on my, yeah.
Yeah.
I'm gonna,
Oh, yes, thank you. Oh, yes, case card. The only other, thought this one was very cute, and the
It is
only
cute.
other one that I really liked was one that you have to like pop out and fold into like flat fake flowers on a table, and I was like, I don't want to give someone work. Yeah.
And Chris, Casey's
Yes.
name is Chris, is that right?
I don't know.
I think it's Chris.
Cool. Oh yeah, do y'all know? Oh, please, please. Mhm.
Is anyone checking with her in the past few days?
You've talked with her?
Okay,
Okay.
I did a couple days ago.
Does anybody want to sign up?
She's amazing.
Her husband was supposed to join her today.
Shalisa, may I borrow your pen? I'm so sorry. I didn't bring one.
Yeah, no problem.
And he was supposed to join her.
Oh, I didn't know she
Today.
was, so she's.
She's at South Point Rehab. Yeah.
Okay.
Oh, wow.
Yeah.
Oh.
Yeah. Also rehab is there. Just look at her shoulders. I mean, it's like, he broke both his hips.
Oh, my goodness. Did someone hit them or?
No, I didn't. It was car accident, that's all I know.